Hey everybody, and welcome back to my channel. I am Lexi, ED nurse by day, sewer and history nerd by night. So today we will be reacting to some nurse and medical Reddit posts. So here we go. The joy of being a nurse. Finally got out of surgery last night and they gave me a keyboard to talk or use the web. Apparently I immediately looked up the YouTube Gangman style video and they told my nurse she was a sexy lady from the song. Oh, that's hilarious. So people react in very funny and different ways to anesthesia, but it's always hilarious. It's so I have so many funny stories. I think one of the best ones I had was a very young chap. We just manipulated a limb, and when he was waking up after we'd done it, he spent the entire time gushing about his girlfriend. It was the most cutest thing I had ever seen. And yes, I did tell the girlfriend when she came in afterwards as well. I always thought nurses are like girlfriends, boyfriends. When you have a good one, life is good, and you take it for granted. When you have a bad one, you complain to all your friends about it. Plus, they also see your junk. I like the comment below. As a nurse, I can confirm this junk seeing. Yeah. Yeah. Oh, that's hilarious. Drugs can screw you up. After my first eye surgery, the nurse told my wife to help me out of the gurney. She told me to hang on to my wife, so I apparently grabbed her breast and wouldn't let go. My wife started to laugh and the nurse was shocked. I don't remember anything. The second time, my wife put my jacket over my shoulders as she was helping me get up. It was a dark grey jacket and I suppose I thought it was a cape because I started slurring. Na 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 Batman! Everyone laughed in the prep area and my wife walked me out to the main waiting area still laughing. So picture myself groggy with a jacket over my shoulders looking pathetic and my wife still laughing her ass off, walking into a quiet area with waiting patients. Everyone stared daggers at her. What an awful wife, laughing at her poor husband. She still kept giggling for a while after we sat down. I remember nothing that time either. Both times I remember getting the IV and then sitting up in a chair with a cup of water half asleep. Oh my god, we could hear so many of these anesthesia stories. This is just hilarious. And the wife, I mean, that's exactly how I would react as well. If I brought my husband out into the waiting room after he did that, I would not be able to contain myself. Worse, I would probably film it as well and then show him later. But funny nursing stories with me. Working a holiday weekend and missing out on family gatherings always makes me a little depressed. Especially when the weather is perfect like this weekend, at least here in MN it is. I don't know what MN is. Manhattan. I'd love it if people would share their funny work stories to help get me and hopefully other people through another day of work. I'll start by sharing mine. My 80-year-old patient was having a rough past few days and was starting to get irritated and snappy at staff. She kept making sarcastic comments towards everyone and everything. I personally enjoyed her sarcasm since I have a sarcastic sense of humour outside of work. I was getting her out of bed for the first time in a while. She was previously strict bed rest, and she kept moaning and grunting. Me. Tell me more about how you're feeling now that you're out of bed. Are you feeling short of breath? Do you have increased pain? Patient. No, I feel like horse. I can't say that on YouTube. Me. Would you say it's more increased pain or increased fatigue? Because horse is not one of the options that comes to me from my chart. And that finally made her crack a smile and made my otherwise crappy shift so much better. I love sassy old people. They're one of my most favourite patients to deal with. I love them. The more sassy they are, the better they are. In skilled nursing currently. Skilled nursing. Okay. Lately, every time I go to do my finger sticks, I alert my patients by saying, "Hello, it's your favourite time of the day. I need your blood." The patient usually says, "Oh geez, you always need my blood." And I reply with something along the lines of, "It's not me, it's this machine. It's insatiable. We have to feed it at least 3 times a day or else." This always gets a legitimate laugh. It makes me laugh too. I think any stab at humour through the day brightens most patients' days. They see their nurse for maybe 10 minutes in skilled nursing because the ratios are so crazy, A little humour goes a long way in building a relationship and trust-comfort. I think the finger sticks is when you check blood sugar for a patient, for a diabetic patient. The comment below makes me laugh. I'm stealing that insatiable machine thing. I'm not crediting you either. It's mine now. Mwahahaha. Well, you know what? I'm going to do the exact same thing. When I next go to work, I go to take a blood sugar. I am so doing this as well. I cannot wait to see their response. Hey Reddit nurses, what's your best nursing joke or funny meme? Oh, this is going to get dark. I can see this is going to get dark. I need a little pick-me-up while on my night shift break. What's the difference between an oral thermometer and a rectal thermometer? The taste. Oh, God. Ah, that's terrible. Funny, but terrible. What's the difference between God and a doctor? God doesn't think he's a doctor. All the comments below make me laugh. I've met a few cardiologists like that. Yep, so have I. What's the difference between bird flu and swine flu? Bird flu give you treatment, swine flu needs ointment. Oh my God. Dad joke. Oh my God. Perfect dad joke. See? Even Reddit agrees with me. Dad joke right there. Right, next one. What did the nurse say when they found a thermometer behind their ear? Some my pen. I'll give you some advice when it comes to nurses. Never ever steal their pen, because one, you never hear the end of it, and they will track you down and make you suffer. Pen is our most precious commodity. Never steal a nurse's pen. You will live to regret it. Let's hear your most morbid jokes. Nurses and doctors, well, even in the medical field really, we have the most morbid, nasty sense of humour. It's quite worrying sometimes, but it's how we get through all the bad stuff that we have to see and all the bad stuff we have to deal with. So, apologies if this offends anyone. Right. What do you do if someone is seizing in a bathtub? You've thrown a load of laundry. Yeah, I think this comment says, well, damn. They spelt it wrong, but yeah. Not very funny. I mean, if you're an epileptic, this could be very insulting. My sister's epileptic, and she's told me this joke before and she finds it very funny, but I understand not all epileptics will. But laughter is not the best medicine. Propofol is. Okay, I think only doctors and nurses will understand this joke, but let me explain. Propofol is a medication that we use to put people to sleep, normally whilst they're ventilated or whilst they're going into surgery. It's a white medication. It's actually what Michael Jackson died of. He called it his milk, I do believe. And propofol works very, very fast, so it doesn't take long for it to take effect. But it's very short acting. So I give someone a little bit of propofol. They'll go to sleep very quickly, but then they'll wake up very quickly. So you've got to have a continuous infusion for it to keep working. But unfortunately, the bad part of propofol is it will stop you from breathing. So that's why only people who are ventilated or going into surgery who are going to be ventilated are given propofol, because it stops you from breathing. It's just why Michael Jackson died from a propofol overdose. So his doctor wasn't being very smart when he gave Michael Jackson propofol. But only medics and nurses, I think, will understand this. Is working in the ER really exciting? I'm a nursing student interested in critical care and debating whether or not I should apprentice in ER or ICU. From what I've experienced so far, seems like ER, although fast-paced, is a lot of boring sickness like flu, COPD exacerbation, etc. that you see over and over again. It seems like you sort of treat the patients for those simple things, then get on to the next one, if I'm not mistaken. I guess my question is the ER really exciting or just busy? What are the key difference between ER and ICU nursing? Comment down below. You're exactly right. There is a lot of boring sickness in ER and a lot of repeat patients. It's not exciting, but it is busy. Two different things, and it depends on your definition of exciting, because I don't find 5 traumas at the same time in a 4-trauma bay to be exciting per se. Okay, so I've worked in both. I know in America they say ER, we say ED, here in the UK. I worked in both ED and ICU. So let's start with ED, shall we? So ED is very fast-paced. It's not very slow, you have to be very, very quick. And you get constant patients. It's like a conveyor belt. They come in. But you can't stop them from coming in, because they're just coming in, and you've got to be very quick. So let's say I've got 3 bays that are free, a rarity nowadays. I can get 3 patients at once. Now I've then got to look at these 3 patients and decide, right, who needs my attention first? Then I'll go to that one, then the next one, then the next one. And more often than not, no one is helping me. More often than not, I'm on my own. I've got to run around with these sick patients. And at the same time, I've then got to chase doctors for treatment. So let's say bed 1 has come in, they've got exacerbation of COPD. So they need nebs because they're very wheezy. Then I've got bed 2 who's septic, but hasn't been seen by a doctor yet. I can't wait because they're septic, so I go to a doctor with a drug chart and go, right, they're sepsis, come see them now. And we follow the protocol. I get the antibiotics and go to the septic patient, while at the same time I'm yelling at another doctor to go see the COPD exacerbation because they need nebulizers. You know, things like that. So ED is very busy. You also get the exciting stuff like cardiac arrests, traumas, but those can be exciting and it is an adrenaline rush as well. Like I remember I worked a night shift once. Started at 8 p.m. In a space of 3-4 hours, we had 5 traumas and 3 cardiac arrests. By the time I had finished with all those patients and resus was semi-tied in restock because it was trashed, it was 5 a.m. and I hadn't had a break yet because I was the only nurse in resus. So, you know, yes, it's exciting, but it's very tiring and you can't be slow and you have to be quick in ED. Now, ICU. Very different kind of nursing because it's one-on-one. You generally only get 1 patient because they're ventilated. And with ICU, it's a lot of monitoring and preempting when something's going to go wrong. So in ICU, we're very good at assessing and stopping things from going wrong and keeping the patient stable. Now, when the patient's unstable in ICU, there's always people around to help, and that when it can be exciting. But actually, I found ICU very, very boring because your patient can't talk. You've only got 1 patient. If your patient is stable, you're sat there for 12 hours watching a patient breathe on the ventilator. But you learn a lot of good assessment skills in ICU and you're very good at preempting stuff that could go wrong. So you take an arterial blood gas and their lactate's high and their base level is high and you're like, why is that? And then I assess my patient, I'm like, they've not peed in a while. You look at your chart, they've not peed in like 3 hours. And the general rule of thumb is that an adult should pee, so let's say I weigh 60 kilograms, I should be peeing 60 mils every hour. Or minimum 30 mils an hour. So let's say this patient hasn't peed in 3 hours, they've got a raised lactate, raised base, they've also got low blood pressure and a high heart rate. So before this gets any worse, because I've now noticed these things are happening, go get a doctor, get them some fluid, they might need some furosemide, might need more blood's taken because their kidneys are going wrong, where if you're on a ward you may not have noticed this for like several days, and before you know, patient's in renal failure. Things like that. So ICU is very, very good, but I personally found it very, very boring. But you do learn valuable skills, especially with assessing, preempting, and just, depends what your vibe is. I found it boring, but I find ED very challenging because I don't like sitting still, I like running around like a headless chicken, so depends what you like. Alright, and that's our last posts. So, let me know what you think. Should I respond to more Reddit, or should I do more TikToks and more films? Let me know, TV shows. Let me know what you think down in the comments below. And yes, and I will see you later.